of our health. At the National Health Insurance Authority, our mission statement is to lead the way in providing access to affordable quality health care that Bahamians deserve. Our vision statement, we are transforming the healthcare system upon which the future well-being of Bahamians depend by putting patients at the center of every decision we make. Our core values speaks to us being passionate, progressive, we thrive on partnerships, we operate with integrity, and we respect and honor our beneficiaries by providing care in all aspects of our service. As a part of the NHI Bahamas Wellness Program, our focus is on 3 tenets, and we encourage our beneficiaries and the public at large to incorporate exercise and physical activity into their daily routine, to understand that food should be your medicine, and to focus on your mental, emotional, and spiritual health. Our overall goal is to ensure that Bahamians understand the importance of living a well-balanced life. And so since our inception in 2017, the National Health Insurance Authority has been deeply committed to leading the way in providing Bahamians with affordable quality health care. We have worked hard to deliver on this vision and advance the path to universal health coverage in the Bahamas. Our enrollment growth speaks to the fact that there are currently over 160,000 plus Bahamian citizens and residents enrolled in the program. Our demographics is diverse, and our current enrollment of Bahamians and legal residents stem from 9 islands, which include 7,000 plus Bahamians under the age of 5 and more than 30,000 school-age children, which makes up our pediatric population, and over 20,000 plus over the age of 65, and we call this population our precious pearls. 96% of those beneficiaries enrolled in the NHI Bahamas program are satisfied with the service that they are receiving from the program. Our provider network is expansive, and we are currently in partnership with 139 physicians from 88 primary care facilities across 8 islands, and we are also in partnership with 14 major labs across 21 locations. Our beneficiary information is documented in an electronic health record platform where the telehealth feature is enabled for applicable visits. Men's Health Month is observed annually in June, and it raises awareness about preventable health problems and encourages early detection and treatment of diseases. During this month, the importance of regular medical checkups, physical activity, and mental well-being for men and boys is also highlighted. There are some key health priorities that are promoted in this month. Preventative screenings. Men are less likely to seek routine preventative care. Regular screenings are vital for catching conditions like prostate and colon cancer early. Heart health. Cardiovascular disease remains the leading cause of death among men. Maintaining healthy blood pressure and cholesterol is essential. And mental health. Despite high rates of depression and suicide, men are less likely to seek counseling or psychiatric care. Acknowledging stress and seeking help is important. This evening, Dr. Eugene Marcus Cooper will serve as our guest speaker. Dr. Cooper is an alumnus of Kingsway Academy and the University of the Bahamas. He was awarded his medical degree from the University of the West Indies and completed his internal medicine and gastroenterology training at the University of Miami Jackson Memorial Hospital. He is board certified in both internal medicine and gastroenterology. He also has a master's degree in healthcare administration from Florida International University and is a lifetime member of the Delta Epsilon Iota Academic Honor Society. He is a fellow of the American College of Gastroenterology, a member of the American Gastroenterological Association, a member of the American Society of Gastrointestinal Endoscopy, and a member of the Association of West Indian Gastroenterologists. This evening, Dr. Cooper will be speaking to us on the topic, taking charge of our mental health. And so, as you are listening, we invite you to share the link, call a friend, especially a male friend or a relative, and ask them to log on to the call so that they can receive this information that Dr. Cooper is going to provide. If by any chance during Dr. Cooper's presentation, should you have any questions for him, we welcome you to type your questions in the chat feature on Zoom as well on Facebook, and we will read those questions to Dr. Cooper during the question and answer period. Dr. Cooper, you are welcome, and the mic and the floor is yours.
Hi, good evening. Mamas, good evening, NHI beneficiaries. Good evening to whoever is listening. Thank you for that introduction. I will not be talking about mental health. I will be talking about men's health. Um, I see quite a few women on the call, probably more women than men. So fortunately for you, all the things that I'm going to be speaking about do not just apply to men. Let me know if you can see my screen.
Yes, we can see your slides.
Okay. All right, so I'm going to be talking mostly about men's health, but also just about health in general, because I figured there would probably be quite a few women on the call, since the call was not restricted to men, and the challenges that we face in healthcare in the Bahamas, um, most of the challenges that we face in the Bahamas affect both men and women. So you can see for the past 20 years at least, we have data that shows that men are consistently dying before women. Some of this is due to violence, of course. A lot of our young men are dying because of homicides and violent acts amongst each other. But even if you subtract that out, men are typically not living as long as their female counterparts. And so sessions like this are very important because men do have issues. The life expectancy in the Bahamas for females is almost 9 years more than men. Um, and that number has probably changed in the past 10 to 15 years because so many of our men are dying at younger ages. But certainly, when you look at the statistics, particularly medically related deaths, men are consistently not living as long as women. Why is that? So every month I see at least one male in my office or in the hospital who has some advanced stage cancer or some advanced medical problem. And you will ask them, well, I will ask them, how did you get here? Like what happened? Why you let this thing go so far? And the simple answer would be, I don't know, doc. I just don't know. Men seem to have this apathy towards their health that causes them to wait until things get really, really bad before they seek attention. They think that, they could work it out, or if they wait a little bit longer, it'll go away by itself, or, it's just gas. Like everybody thinks, you blame it on gas, it'll go away. You drink tea. But not until things have become really, really drastic or very painful do they seek any sort of medical care. And a lot of times, by the time they do seek some attention, it's too late. Men are less likely to acknowledge that they're having a problem. They're used to being strong, the head of the house. There's this ego thing. They don't want to admit that they're not feeling well until they just can't handle it anymore. They're too busy. They're working, they're taking care of their homes, they're taking care of businesses. They just can't seem to squeeze in taking care of themselves. It's not really a priority. And then when they do, they typically don't talk about all of the issues that they're facing. Some of the best medical histories that I get about a man are from their spouse. And it makes a whole bunch of difference when the wife is in the room than when the husband is in the room by themselves. They will tell you, oh, well, he was having this, and oh, he was seeing blood, and oh, he couldn't pee, and oh, he was doing none of these things he would have told me on his own, but the wife will fill in a lot of gaps. And because of that, sometimes we don't even pick up what the problem is for months because we haven't been given a full history. And then also, men are less likely to actually access medical care. Women will go to a doctor every month when they're pregnant. So they're used to seeing the doctor. Then they go with their kids to do the infant checks and the well baby checks. So women are used to accessing the healthcare system, and men are not. And so when it's their turn, they will always have an excuse of why they don't go or why they haven't been. And so these are some of the things that cause us to not be able to pick up medical problems earlier in men and result in them dying much sooner than they have to. So what's killing Bahamians? And this is not, I'm going to start with some things that are affecting both men and women. And then I'll talk about things that are specific to men. So, in my opinion, and this is probably not just opinion, this is fact when you look at the data of what our mortality rates are attributed to, what's killing Bahamians is lifestyle. Heart attacks, strokes, kidney failure, a lot of these things are preventable if you just focus on your lifestyle. This is what is killing Bahamians. Not just breakfast, but foods in general. And so, this is what many of us start our day off with, right? Lots of grease, heavy foods, sausages. And I like this slide because I always like to make the distinction between sausage and sausages. Bahamians love their sausages. And if you take a minute to just read the label on the big slab of sausages, salt content, out, I mean, just off the chain, fat content off the chain. And this is what we're eating on a daily basis. Can't forget this, the tuna and grits. Got to have plenty mustard on that. And the corned beef and grits got to have plenty grease on the side so that it's soupy. These kind of things people don't understand over 20, 30 years are doing things to your body that's going to cause you to develop problems in the long run. And then after breakfast, we followed up with one of these, some fast food, or some crack conch and fries. Usually you gotta, it's not fries, it's rice. And this is every single day. And you could, I mean, we don't think about it, but we eat like this for lunch. We eat like this for breakfast. We go to events on the weekend. We have more of the same. I mean, this is what we're eating every day. Every now and then we might get a vegetable in there. You could see the lime all the way to the back with your snapper and your rice and whatever. I guess that might be considered your vegetable. But very rarely will you see any green on the plate. You want to make sure that you have some food left over. When you have a function, put out a salad and you will have lots of it because we don't like the healthy stuff at all. And this, I think, is what's really contributing to the unhealthy. And the Bahamas is extremely unhealthy when you compare us to other countries in the world. Uh, if you exclude these Pacific islands, the top five, the Bahamas is one of the most obese countries in the world. Not just in in the Caribbean, not just in the Western Hemisphere, in the world. Our obesity rates approaching 50%. And I would say that we probably, if you're looking at just overweight and obese, we're probably in the 60% range. And that's basically because of lifestyle. We like food, we love food. And because, they say if you love it, let it kill you. And that's exactly what it's doing. So here's some of the side effects of obesity. A lot of us don't think that we are obese, but if you, and I'm going to, in the next slide, we're going to talk about obesity. And if you fit into a certain parameter, you're obese, whether you want to realize it or not. So here are some of the consequences of being overweight and obese. Acid reflux, which is what I see a lot of every day, heartburn, high blood pressure, sleep apnea. And a lot of you may not know what sleep apnea is. It's when you're snoring at night and sometimes you wake yourself up because you actually stop breathing. Heart disease, heart attacks, gallstones and diabetes and kidney problems, joint issues, arthritis, etc., erectile dysfunction. A lot of these issues are directly the result of lifestyle and obesity in particular that we don't realize. So, who's obese? If you're on this call and you think you're just solid and you're not obese, I want you to Google BMI calculator and you plug in the numbers. And the BMI is basically your body mass index, and it's a way of standardizing people's weight based on their height. And if you find that calculator on your phone or your smart device, and you punch in your height, your real height, not the height that you want to be, but your actual height and your weight, and your BMI is greater than 30, you are obese and you are at risk of all of those things that I showed in that previous slide. Uh, Hypertension is one of the major complications or side effects, sequela, as we call it in medicine, of obesity. Lots of Bahamians have high blood pressure, and the ones who don't know they have high blood pressure just don't know it. Hypertension or high blood pressure is probably an epidemic in the Bahamas. And I will see people all the time and they say, well, they told me I have high blood pressure, but I ain't claiming it. And so they don't take the medication. Or they take the medication when they feel away. If you have been to a doctor or some clinic or some healthcare facility and your blood pressure was greater than 140, the top number, or 90 on the bottom number, more than likely you have high blood pressure. And you could give all kind of excuses. You was rushing to get there, or you didn't sleep, or somebody made you mad on the road, and so your blood pressure is probably high. Chances are that if somebody has taken your blood pressure and that top number was greater than 140 or the bottom was greater than 190, you have chronic high blood pressure and it's not going anywhere. And you don't feel it. There's a reason why they call high blood pressure the silent killer, because most times you don't have symptoms. And when you do, it's because something is really wrong. If you're in the 29 or 130s, over 80s, your blood pressure is not bad. I mean, it may be a little bit elevated, but that's not considered high blood pressure. But if you're above 140 over 90, and on more than two occasions, you have chronic high blood pressure, and you should be on some sort of medication to keep your blood pressure normal. Now, some of us can reduce our blood pressure by losing weight. There are non-medical supplements that, if you have mild high blood pressure, will lower your blood pressure. If you exercise, it tends to lower your blood pressure. But for many of us, including myself, despite doing all of these things, you have inherited high blood pressure, hypertension. And medication is probably the only way that you can get it down. I've tried the breadfruit leaf tea, the moringa, the shepherd needle tea, you name it. I've tried it. I've lost weight, I've exercised, and I still have high blood pressure. So while you may think that, you could probably get your blood pressure down by taking moringa and hibiscus tea, if you have high blood pressure in your family, your mother has high blood pressure, your father has high blood pressure, your Grammy had high blood pressure, it's very likely that you too will have it, whether you claim it or not. And if you do not manage it with medication, it is doing damage. What are some of the reasons why people get high blood pressure? Men seem to be affected more than women. As you get older, your blood pressure sometimes will increase, not all the time. Obesity is definitely a factor, and then genetics. Stress, lack of sleep should also be in there. If you have a high stress job, if you work in a high stress environment, if you have a stressful lifestyle, this can elevate your blood pressure. Problem is that a life without stress is really not a life. I don't know of anybody who has a stress-less lifestyle. Uh, and if your blood pressure is very high, you probably need to do something about it. What you can do, stop smoking if you do, alcohol in moderation or not at all. Caffeine can increase your blood pressure. So if you're, you know, on coffee 2 or 3 times a day, this might be contributing. High salt diets, high fat diets, lots of processed foods, fast foods, all these things contribute to blood pressure elevation. And you need to be aware of it, right? You need to go, if somebody told you your blood pressure was high and you're not on any medication, go to the clinic, go to the doctor's office, have it checked, and take it seriously. Why is it serious? Because you can end up with a stroke. And every single solitary day, we are having people admitted to the hospital who have high blood pressure and develop a stroke. Real strokes, where you can't move your left side or your right side, or you have other types of strokes. We have the strokes where you bleed, and then we have the strokes where there's a blockage. But strokes are definite side effects or complications of having high blood pressure. Kidney disease. Our dialysis units are overwhelmed with patients who have kidney failure as a result of high blood pressure. And again, you don't feel this until one day you end up in the hospital, you're not feeling well. And I just last week I had a lady who was admitted. She came to say that she was feeling lightheaded and dizzy. Blood pressure was 180 over 110, and did her blood test, and she was in kidney failure. Had to go straight to the hospital. So these are the type of things that happen when you have blood pressure that is uncontrolled and unmanaged for long periods of time. So let's segue into diabetes, another big problem that we have in the country. Uh, if your blood sugar levels are greater than 126, and this is fasting, first thing in the morning before you have anything to eat, you have high blood pressure. And if your blood sugars are over 200 at any point in time, sorry, I think I said high blood pressure, over 200 at any given time, you have diabetes. Um, don't wait until you go into a hyperglycemic state where your blood sugars are really, really high and you have to be hospitalized. Blood sugars that are fasting greater than 120 something, 126 or 200 at any time. This is something that needs to be managed. Diabetes can cause tremendous complications, tremendous. If you are a diabetic, then you need to know about something called your hemoglobin A1C. It's what we look for, it's what doctors look for to see how well you've been controlling your diabetes over the past 3 months. If your hemoglobin A1C or HbA1c is in the 7, 8, 9, 10, 11, 12 range, you are not controlling your blood sugar. And chances are you're eating a whole lot of garbage. You still think you could eat fast food and plenty rice and plenty bread and get away with it, but you can't. And one day it's definitely going to catch up to you. Complications of diabetes unmanaged, foot ulcers, eye complications. We have we have a waiting list for eye surgery, a lot of which is due to high blood pressure and diabetes. That is months. We're sending our patients, or were, I don't know if it's still happening, to Cuba. That's how many people we have, and we can't accommodate them. Um, Neuropathy, which is when you get numbness and tingling in your toes and you can't feel it, and you get a cut, and it becomes an ulcer, and it becomes infected, and they have to amputate your toe. Just last week, a patient came to me, diabetic, uncontrolled, had a manicure, they cut the cuticle, and it turned into an infected mess. And the finger had to be amputated last week, Friday. So having high blood sugars that are uncontrolled leads you to lots of complications. Nephropathy, which is kidney failure, heart disease, high blood pressure, stroke. If you have diabetes, you are at risk. And if you have high blood pressure and diabetes, you're even at more risk. This is a slide I threw in here because a lot of people don't realize how much sugar is in starch. These are sugar cubes. Two, four, six, eight, 10 sugar cubes equal to two slices of bread. So you eating, you having bread, particularly white bread, in the morning, and then you having a sandwich for lunch or for dinner. That is converted to sugar in your body and is really making you, if you're diabetic, it's making your blood sugars worse. Rice. We all like rice. Matter of fact, sometime after I went away to school, rice became a breakfast food. And you go into these breakfast establishments and you can get grits, but now you could also get rice. And not just a little bit of rice, like a pound of rice. If you're diabetic or you're pre-diabetic, you're killing yourself with that stuff. French fries, the same thing. I mean, I can't even count. That's what three times five is 15, 16 sugar cubes, the equivalent of eating French fries. So you got to understand what you're eating and how it correlates to blood sugar if you're diabetic. How do you deal with your diabetes? You got to take your medication. If you're on insulin, you got to take it. If you're on tablets, you have to take it. You have to maintain a healthy weight. If you're diabetic and you're obese, that's a double whammy. If you're not exercising, you're shortening your lifespan. It's as simple as that. You have to control those other factors if you have high blood pressure or cholesterol. All of these things combined make you a walking time bomb. And if you're a smoker, you got to quit that. Okay, so now it's 7:30. I'm going to switch over to men's health. What I was talking about before affects men and women equally. Now I'm going to talk about things that affect primarily men. Diseases of the prostate. That's the biggest thing. If you're a man and you don't know what your prostate is or where it's at, it's right there. It's between your rectum and your bladder. It's actually right underneath your bladder. And because it's sort of at the neck of the bladder, your urinary symptoms is what usually comes first when you have an issue with your prostate. Um, it was usual and customary for a doctor to put his finger in your butt to feel your prostate. And because of that, men was like, I'd rather die than to have somebody put their finger on my butt to feel my prostate. And for that reason, and for others, we're not doing so much of these rectal examinations anymore. We found that it's not consistently effective in determining who has a prostate issue and who does not. In some people where their prostate is very, very large, you can feel it. You feel it very well, and you can tell right away if this person has an enlarged prostate. Um, Also, if it's big and it's hard and it has like lumps on it, chances are that's prostate cancer. So there still is some benefit, and some doctors may still do it. I think right now, though, most doctors are just doing the PSA blood test, which I'll talk about in a little bit. But if you have to have your prostate checked out, it's much better and it's less painful than dying from prostate cancer. So for men, what can go wrong with your prostate? It can get enlarged. We call that BPH. You can get an infection. We call that prostatitis, and you can get prostate cancer. BPH or benign prostatic hyperplasia refers to when the prostate is swollen, and what you can see here is that it pinches off your urethra. The urethra is what's in a male is the tube that goes from your bladder through your penis so that you can pee. And when that is being clamped off by an enlarged prostate, men will start to have BPH symptoms. Waking up in the middle of the night to pee two and three and four and five and six times. Going to pass urine and not being able to get it out right away. You got to wait a few seconds before the stream starts. Or having the need, when you feel the need to go, you have to go right away because you feel like you're going to wet yourself. All of those are symptoms of an enlarged prostate. Um, Hesitancy is having that weak stream, so to speak. Pee is not coming out right away. The dribbling, you got to shake it 10 times. All these things are symptoms of BPH, and you should see a doctor about it. Medications, those of you who have prostate issues, if you're a man, these are some of the things that we're using. Cialis is a new medication. It's a bonus. If you know how Cialis works and you get put on that for an enlarged prostate, that's great, and you'll see why. Sometimes surgery of the prostate is necessary. It's called a TURP. Uh, a TURP is just when you sort of shave the prostate down so that what was previously clamping up your urethra and preventing your bladder from emptying has now gone, and you can have a free flow of urine. Usually, should not be a first line therapy. If you've tried medications and it's not effective, or you're still having symptoms despite being on one or two or maybe even three BPH medications, then a TURP may be something that provides some benefit. Supplement saw palmetto is something that has been around for decades, and it may not help in every person, but we do think that in some people, saw palmetto may help to slow down the symptoms of BPH. And they have lots of different um, um, companies that make saw palmetto. Um, you can find it in any pharmacy over the counter. And so if you think, you're having some BPH issues or you want to start to focus on your prostate health, saw palmetto is not a bad way to start. It may not help everybody, but it certainly won't help. It won't hurt as far as we know, and it's something that you can try on your own. Uh, by the numbers, prostate cancer is the number one most common cancer among men in the Bahamas. This is taken from Dr. Pinto, one of our urologists here. One in six men in the Bahamas will be diagnosed with prostate cancer. That's alarming. That's alarming. When I was in the US, we didn't see prostate cancer that much because it doesn't affect white men as much as black men. But men of African descent seem to be at highest risk for prostate cancer. And some of the worst prostate cancers that you want to see, where it spreads to the bones and other organs, and it's just destroys the body with these cancer cells. So prostate cancer, if you catch it early, is treatable. And it's very important that if you're a man and you're over the age of 40, that you should start to have some sort of prostate cancer screening. Um, Prostate cancer, if as you're getting older and you're African descent or you're black, you have a family history of prostate cancer, this is something that you want to be aware of. And you want to be getting your PSA every single year after the age of 40. PSA is the blood test that we do that has replaced that rectal examination. Sometimes your doctor will send you for an ultrasound of the prostate if they think there's a lump there. I think right now the standard of care is an MRI. It is a bit expensive and it's not available in the public sector, but the MRI is a non-invasive way of determining whether or not you have a lump in the prostate, which could be cancerous. Prevention, low-fat diet, selenium has been shown in some studies to help to prevent prostate cancer. Aspirin and ibuprofen, which I would not recommend on a regular basis because of some of the gastrointestinal side effects like ulcers and bleeding, and vitamin E. Okay, let's talk a little bit about erectile dysfunction. What is that? Inability to attain or maintain an erection of sufficient quality to permit satisfactory sexual intercourse. Now, I know some of the women on this call are here because your husband is having this problem and you're trying to figure out how to tell him what to do. This is a huge problem in the Bahamas, and it's not just a problem of older people, this is a problem of younger people as well. 50% of men from 40 to 70 can have erectile dysfunction. More prevalent in people with diabetes and also in older men. But we're starting to see a lot of erectile dysfunction that's related to um, obesity, to marijuana consumption, particularly habitual marijuana consumption can affect your erection as well as your fertility levels. So alcohol, And we know we have a lot of drinkers in the Bahamas. Um, Alcohol will depress not only your sex drive, but your ability to maintain an erection. So there are lots of reasons why men will develop an erectile dysfunction. And it's also associated with cardiovascular disease. It's associated with hypertension, stress, alcohol, like I mentioned. There's some medications that you can take. If you're taking a medication for blood pressure and you notice that it's affecting your ability to get an erection, you need to talk to your doctor so you can switch it up. Smoking, low testosterone is something that we also check for. So men, if you're on the call and you're having an issue, don't be afraid to talk about it. Seek help. And women, if it's your partner or your husband who's having an issue, uh, try to find a way to, if he has some of these other conditions, to say, look, I mean, maybe you should go and check out your blood pressure, your diabetes, whatever the case may be, so that we can take care of this problem. Um, I'm going to skip that. I'm going to skip that. If you're on medication and you think it might be causing you to have an issue with getting an erection, some blood pressure medication, some of the water pills, some heart pills, hormone therapy, recreational drugs, all of these things can be associated with erectile dysfunction. And how do we treat it? Viagra, Cialis. Uh, uh, I see on social media there's some doggy juice that's selling off the shelves, or donkey juice, or both. You might want to talk to a doctor before you start taking these things or something or the stuff in the gas stations, because if you have high blood pressure, diabetes, these medications typically will lower your blood pressure and can cause you to have a heart attack or a stroke. So if you have erectile dysfunction and you have some of these chronic issues, make sure you're not just taking things indiscriminately without at least asking a doctor, is it okay if I take this? And let them do some sort of workout to see if there's a problem, that if they correct that problem, it might help. Okay, lastly, I think I want to talk about colon cancer, which is my area. Uh, we are seeing we are seeing colon cancer rates increase exponentially in the country. And a lot of that is due to lifestyle, and some of that is due to genetics. Risk factors, obesity. So if obesity is a risk factor for colon cancer, you can see why our rates are so high. High fat diets. The Bahamas is one of the highest consumers of fast foods per capita in the world. As a matter of fact, one of our fast food chains, which will remain nameless, is has been said to be one of the highest grossing fast food chains in the world per capita. That's how much fast food we're consuming here. Um, I did some research that I was helped through Inland Revenue, and I think my stats showed about 868, if I remember correctly, fast food restaurants in New Providence alone. 868 over 7 by 21. That's huge, and they're all making money. Smoking, family history, also risk factors. What are the symptoms of early colon cancer? This is a question. But in the interest of time, I'm going to answer it. So, early colon cancer, there are no symptoms. There are none. So, don't wait until you develop a problem. Colon cancer is like high blood pressure. You don't want to wait until you feel it before you address it. And this is why we recommend colon cancer screening after the age of 45, before you have problems. Once you start to feel something, and those things are blood in your stool, unexplained weight loss. You lose 10, 15 pounds. You're just not sure why. You haven't changed your diet. You're not exercising more. You may have some mild abdominal discomfort that you've been saying is gas for years. This could be a symptom of colon cancer. Change in your bowel habits. You were previously going every day, now you're going every 3 days. Or you were going every 3 days, now you're going 3 times a day. Any change in your bowel habits, particularly after the age of 45 or 50, should be investigated. Unexplained anemia, particularly in a man or in a woman who's no longer seeing their periods. This could be a sign of something going on in your bowels. That could be early colon cancer or a large polyp that bleeds. small amounts of blood that you can't see, you should have that checked out. Unexplained abdominal pain. So all of these are things that happen when you have colon cancer that is advanced. In its early stages, you won't feel anything at all. Um, so this is what we're trying to prevent. You can see on the left side of your screen, this is what a colon looks like when it's nice and clean, no problems. You develop a small polyp. This is a pedunculated polyp. It has a stalk like broccoli, or it's flat. And then over time, it turns to colon cancer. So we know if we catch you, if we do your colonoscopy early in the course of your life, once you hit 45 or so, you're less likely to have a polyp. And if you do, there will be a small one that we can remove in just a few minutes to prevent you from going over to that cancer stage. So this is why we stress colon cancer screening. Colonoscopy is the gold standard. It requires some sedation, meaning that we have to put you to sleep. You have to drink some stuff the day before to clean out your colon. We go and we take a look, and if we see something, we can take it out at the same time. That's the gold standard. And the reason it's the gold standard is it's the only test that allows you to look and see and act or remove at the same time. The other tests, like your stool test, it's a screening test. We look for microscopic amounts of blood in your stool. The FOBT is the test I think that's being done in the public clinics. The FIT test is being done in the NHI facilities. Both of those tests are designed to detect microscopic amounts of blood in the stool before it becomes obvious to you. And we know that in many cases, that is a sign that there are some polyps that are in there. We do the colonoscopy and we can remove it. The stool DNA test is it's a more expensive stool test, but it's also on the market called Cologuard. That's also a screening test. The sigmoidoscopy, we're not doing too much of. It's like a colonoscopy, but it doesn't go all the way. And then virtual colonoscopy, which is also called a CT colonography, or virtual colonoscopy, is what's performed by the imaging facilities in the country. And it's basically a CAT scan. It's the same thing as a CAT scan. It can identify larger polyps, but if you find it, then you have to go and do the gold standard, which is the regular colonoscopy to have something taken out. Like I said about the colonoscopy, you get sedated so you don't feel it. It requires you to drink some stuff the night before. Contrary to what you may have heard, it is not painful, it is painless. Most people are not even aware that they had something done when they woke up. And again, we can remove polyps at the same time. We don't have to bring you back to take out a polyp. And once you have a colonoscopy done, if it looks good, you don't have to do it for at least another 7 to 10 years. And that's great. So this was a video. I don't think I uploaded the video, but this is what a colonoscopy, or what your colon looks like when there's a clean prep, and we can see any polyps, any bumps that may be there, so we can take it out. What can you do to reduce your risk of getting colon cancer? Exercise, all the things that we don't like to do as Bahamians: exercise, eat healthy, high fiber diets, stop smoking, drinking alcohol in moderation, all those things that we hate. This is what you can do to reduce your risk of colon cancer. It requires some discipline, um, which we lack. And so that's why I will always have a job. Losing weight is a really good way to prevent colon cancer as well. So in conclusion, what can you do about your health? Men, women, in general. I'll start with the one on the right first. See a doctor. If you're over the age of 40, man or woman, you should be seeing a doctor every year. Get your blood test done. Give a healthcare professional the opportunity to kind of look at your labs and see if something is awry, to talk to you. You can tell them what complaints you're having. Uh, Go and see somebody. Make it a priority. Do it on your birthday. Um, do it, on your vacation, but do it. Get it done. Don't let a year go by. Eat healthy, exercise, and together we can all build a healthier Bahamas. Thank you.
Thank you so much, Dr. Cooper. And at this time, I would like to encourage those persons who would have questions for Dr. Cooper. You're welcome to place your questions in the chat. for him, and then we'll read those questions to him. So I'm just checking for you, Dr. Cooper, if anyone placed any questions in the chat. As we wait for questions, Dr. Cooper, I would also want to say thank you for that. I like that you looped in healthcare for females, and then you also concluded with the men's health awareness aspect. It was very informative, and I thank you for making the connection that all of these chronic non-communicable diseases, you can avoid them the same way. And at some point, they tend to build upon each other. And so if you often overlook one, it can also cause a snowball effect as it relates to your health. We have a question on Facebook, Dr. Cooper. If you find polyps, when should you have another colonoscopy done?
So it depends on the size of the polyp or the number of polyps that you find. Whoever does your procedure should tell you after they remove the polyp, they send it to the lab, they get it back. They should be able to tell you what when your next colonoscopy should be. So typically, if there's small polyps and there's less than 3, you can still stick with the 7 to 10. It's a really big polyp, or if it's an advanced polyp and we send it off to the lab, that interval may shift down to every 5 years or even every 3 years. So it all depends on what we find, how many polyps, the size of the polyps. Also, if your family history, if you've got a first-degree relative who was diagnosed with colon cancer before the age of 60, that puts you in a high-risk category, and you should have a colonoscopy every 5 years. So rarely, if ever, is it as frequent as every year, every 2 years, or every 3 years. But somewhere between 5 to 7 to 10 is the recommendation that you'll be getting from your physician.
Okay, thank you for that, Dr. Cooper. We had a few more questions come in. The next question is, what are some reasons you would not remove an abnormal growth during a colonoscopy?
If it's too big to remove it during the colonoscopy, you'll need surgery. Or if it starts to bleed a lot when you're trying to cut it off, they would recommend surgery. If it looks like it's a cancerous growth, you'll need surgery. So if it's just too big to remove or it looks suspicious for cancer, then the correct and appropriate treatment would be to have surgery to remove it. Otherwise, if it's small enough, you should be able to take it out during the actual procedure.
Okay. Thank you for that. Someone is asking for you to go back to the acronym BHD. Can you tell us what it stands for? I think they would have missed that explanation.
BHD?
BHD? Yes. Is that correct? Is the acronym correct?
I don't remember. BPH, maybe?
Maybe BPH, yes. Maybe BPH.
That's benign prostatic hyperplasia. That's an enlarged prostate. I don't remember using the acronym BHD.
Yeah, neither did I. But now that you say BPH, I think that's the correct acronym there.
Right.
All right, I'm going to read a question, Dr. Cooper. I'm 72 years old and I've never had the colonoscopy done. After listening to this program, I feel like I really need to have it done. What do you suggest? And what is the average, I guess, cost of the procedure?
So at 75, the US recommendations don't advocate for a screening colonoscopy after 75 if you don't have symptoms. You're 72, And if you're otherwise healthy and you don't have symptoms and you feel good, then some form of colon cancer screening is appropriate. Now, remember I said that the colonoscopy is the gold standard, but maybe for you, I would send you for the stool test. And if you had a negative stool test, then I would go no further. If you have a positive stool test and you're in good health, then I would say, sure, let's do a colonoscopy and see what caused this test to be positive. But if you have a negative stool test, which you can get at the clinic or at an NHI facility, I would do that at 72. I would probably repeat it again at 73 or 74. And after 75, if you've had a few negative tests, then I would not screen you anymore after that.
Okay.
The cost of a colonoscopy depends on where you have it. Can range any in the public system. I think it's about 400 and something dollars. Privately, it can be around 2,500 to $3,000.
Okay. Thank you for that, Doc. Another question. Hello, I have hemorrhoids. Will the stool test be effective, or would you suggest a colonoscopy?
Great question. Great question. Um, yeah, if you have actively bleeding hemorrhoids, a stool test is not going to be effective. It'll be a false positive. So if your hemorrhoids are not active, then I would recommend that you go and get it. Sometimes even if you may have internal hemorrhoids and you may not know it, and that may give you a false positive test. Um, but I would say if your hemorrhoids are not active, go ahead and start with the stool test. And if it's positive, whether it's from hemorrhoids or otherwise, then we would still go on and do the colonoscopy. I think it's more important to make sure that there's not something more serious going on. And then we know it's just hemorrhoids that you're dealing with. So if you're over the age of 45, have some tests. Either one. Do the colonoscopy. If your hemorrhoids are active and they're problematic, then that may also be a time when we can do something about it, something called banding, where we can apply a band to the hemorrhoids on the inside. So choose one, get it done.
Okay, thank you. And I think that person came back and said that they were 50, they're 51.
Yeah, so get something done.
Okay.
Get something done. Doesn't matter which one, but have something done. And if your hemorrhoids cause your stool test to be positive and you have the colonoscopy, that's fine. At least you'll know that everything on the inside is clean and you can follow up at the regular intervals. Even in your case, if you had a normal colonoscopy, there was no polyps, and you started seeing some blood 2 years later, if you came to me, I would not be alarmed at all, and I would tell you, don't worry about it. You had a colonoscopy 2 years ago. We saw that everything looked normal. Let's stick with the regular screening guidelines of 7 to 10.
All right. Thank you for that, Doc. What to do if the medication for BPH does not work?
Right. So if you've been on one or more BPH medications and it's not working, or you're having side effects that prevent you from taking it consistently, then you might, and your symptoms are really disrupting your lifestyle. You're getting up 4 or 5, 6 times at night. You're every time you go out, you got to wonder where the bathroom is because you might have to go and urinate. Then that's an indication for surgery. Um, and you should talk to one of the urologists about doing that TURP procedure so that you can get off medications and live a more normal lifestyle.
Okay. Dr. Cooper, were digital rectal exams discontinued?
I wouldn't say discontinued, but we don't we don't add the medical societies are not advocating rectal examinations anymore like we were for prostate cancer screening. There was too much variation in the process, and it was not reliably able to identify prostate cancers. And so the PSA blood test has become the test of choice for screening. Uh, we know that every prostate cancer may not have an elevated PSA, and every elevated PSA may not be prostate cancer. But we start with the PSAs, and if the PSA is elevated, then you're probably going to have a secondary test, maybe an ultrasound or an MRI. If your doctor is suspicious based on some other blood tests, they may decide to go ahead and do that rectal examination and to feel the prostate. So I wouldn't say that it's been discontinued, but we don't advocate or recommend it as a primary
Nice.
way of screening for prostate cancer
All right.
anymore.
Thank you for that thorough explanation, Dr. Cooper. I think we have about two more questions left, and then I will turn it over to Mrs. Cece LaFleur to deliver our vote of thanks. So this next question, what causes stomach ulcers? And what are symptoms related to stomach ulcers?
So stomach ulcers can be caused by a variety of things. Medication is probably a very common reason why, particularly pain medications. Pain medications like aspirin, Motrin, Aleve, ibuprofen, Excedrin, Arcoxia, Celebrex. If you're taking these medications on a regular basis, particularly as you get older, you can develop a stomach ulcer. That's probably the most common reason. Another reason is a bacteria called H. pylori. H. pylori, and the H stands for Helicobacter. H. pylori is a bacteria that can get into your stomach. We think it's from contaminated water. That's the source. H. pylori is that bacteria can get into your stomach. It can attach to the lining of your stomach, can cause inflammation, which can lead to an ulcer. If you have H. pylori and you're taking one of those medications that I mentioned, then your risk of developing an ulcer is twice as high. When people come to seek medical help and they have symptoms of an ulcer, which may be abdominal pain, it may be lots of burning, it may be pain after eating certain foods, spicy foods, greasy foods, etc., nausea and vomiting. If it sounds like an ulcer and you're on lots of pain medication, we may check for this bacteria. And if you have it, the first step is to treat it. So those are the two main things. Alcohol also can cause stomach ulcers. I think those are the three most common reasons why people will get an ulcer. And effectively diagnosing it requires an endoscopy, which is where we put the camera down the mouth into the stomach. And the treatment is pretty simple. But if the bacteria is identified, you'll also require a couple of weeks of antibiotics.
Thank you. Thank you for that, Dr. Cooper. And then our final question, I was checking to see if we had any other questions come up on Facebook. But this question I saved for the end because I know I'm sure other persons would want to be privy to this information. But this question is, how can I get an appointment with Dr. Cooper? So Dr. Cooper, can you share with us your contact information? Where can we find you outside of this beneficiary educational session as it relates to your practices, your private and your public practices?
So GastroCare Bahamas, we're on the corner of Collins Avenue and 6th Terrace. If you Google my name or you Google GastroCare Bahamas, I'm sure you'll find me. I'm also at Princess Margaret Hospital. If you're seeing a doctor in the public setting, or if you're seeing a doctor at the hospital, they can refer you to the gastroenterology clinic. There are three of us, but my clinic is every Friday. So either way, you can come to the office, call the office, or get a referral to the gastroenterology clinic at Princess Margaret Hospital.
All right. And Dr. Cooper, do you travel to any of the family islands?
Yes, I go to Freeport once a month, most months, and I'm at the medical pavilion over there. So you can call the medical pavilion and they can get you scheduled to see me as well. And I go to Pierce Plaza, which is a part of the Rand Memorial System, and I see public patients there.
All right. Thank you so much, Dr. Cooper, for answering the questions that were posed to you tonight. I would like to now turn over this evening's part of this program to Mrs. Cece LaFleur. I'd like to welcome her. She is our Director of Human Resources, Facilities, and Wellness at the National Health Insurance Authority, and she will deliver our vote of thanks.
Good evening, everyone. Dr. Eugene Marcus Cooper, I think you lost the crowd initially when you said we had to eradicate, is it sausage? Sausage from our diets, right? I think that starting off with that, and then you scared us straight throughout your entire presentation. Um, to really put in our faces, and I know it's more so geared towards men, how truly crucial this is, how our lifestyles, how what we do. And I think my takeaway, the biggest one was you have to have discipline, and we lack discipline. And then you, with a little bit of shade, said, that's why I'll always have a job. And I think you said that kind of tongue in cheek because if so, you wouldn't be on this call. And want to say thank you, truly thank you so very much, because hopefully some of the pearls that you certainly laid before us, these pearls of wisdom, will assist us in elevating our health, truly. And we certainly don't want you to be unemployed, but I will say that if we as people really are disciplined, we really follow through as it relates to healthcare professionals such as you, taking the time to educate us and having us do what we need to do, we can certainly at least lessen the visits that we would have to offices such as yours. But thank you so very, very much for laying it out, the good, the bad, the ugly, and of course, what we can do to turn this around. Because at the end of the day, as you stated, it takes discipline, and only we can have the power to take care of our own health. And we thank you so very much for imparting what we can do, certainly, to elevate, not just for ourselves, but overall. Our statistics in this country aren't the best. And I think if we collectively get together and do things such as this and have healthcare professionals such as you educating us along the way, we'll certainly be a much healthier society. So once again, thank you very much for your time this evening.
And Mrs. LaFleur, it is critical, having been in the Bahamas for so long, that you are able to say Sauchets.
Sausage.
No, no.
Well, you spelled it phonetically for me. Sauchess.
Which is,
Sauchets.
thank you very much. Thank you very much. Have a good
Thank you. Thank you. Thank you.
All right. And so as we wrap up this evening's session, we just wanted to remind you of what there is to look out for as it relates to our wellness initiatives. Next month, you can save the date, Thursday, July 16th, for our monthly installment of our Power Hour. And so we want to thank those in the listening audience who join us on a monthly basis. Continue to support and travel with us. We also would want you to continue to look at our Facebook as well as our social media pages for more updates and information as it relates to July's Power Hour. Why does annual physical exams matter? And I want to say thank you, Dr. Cooper, for taking a lot of this off of my plate this evening, because I like that you ended your presentation with how can we things that we can do to make it better. And the first thing you mentioned was making sure that we visit our provider at least once a year for our annual wellness exams. It helps us with preventative care. It helps us to get personalized health advice from your primary care physician, and it also helps you to build your medical history. And so if you're able to see any changes in your medical history, your doctor, your provider, as well as yourself can jump on it automatically to help to keep you happy, healthy, and whole. And so here at NHI, we're partnering with you in health and wellness. We're creating healthier communities and promoting our beneficiaries